Welcome to the Tiny Tots Guide, Umbilical Cord and Circumcision Care. Hey new parents, welcome to the Tiny Tots Guide. Becoming a parent is an incredible journey filled with so much joy, but we also know it comes with a lot of questions. Two topics that often cause a little anxiety are umbilical cord care and, if applicable, circumcision care. You want to make sure your tiny tot is healthy and comfortable, and knowing the right steps is absolutely key. That's exactly why we created this comprehensive guide just for you. We're going to break down everything you need to know to feel confident and capable in these important aspects of newborn hygiene and health. Understanding the umbilical cord stump. What's normal and why it's there? First, let's talk about the umbilical cord stump. It might look a little strange, but it's a completely normal part of the newborn healing process. This stump is what's left after the cord connecting your baby to the placenta is clamped and cut. It's essentially a small piece of tissue that will naturally dry up and fall off on its own. It might look a bit yellowish, brownish, or even black as it dries, and that's all part of the normal process. Step-by-step daily umbilical cord care and cleaning techniques. So, how do you take care of it? It's actually very simple. The goal is to keep it clean and dry. Gently fold your baby's diaper down below the stump to expose it to the air, which helps it dry out faster. When you're giving your baby a sponge bath, you can clean the area gently with a cotton ball or swab dipped in plain water. Just pat it dry afterward. Remember, no tubs until the stump has fallen off. Key signs of umbilical cord infection, when to worry and what to look for. While most stumps heal without any issues, it's important to know the signs of infection. If you notice any redness or swelling around the base of the stump, a foul odor, or a yellowish pus-like discharge, those are all red flags. Another key sign is if your baby seems to be in pain when the area is touched. If you see any of these, it's time to call your pediatrician. The umbilical cord healing process, what to expect before it falls off. The stump usually falls off within 1 to 3 weeks. You might notice a little bit of blood or a small scab as it detaches, and that is also completely normal. Once it has fallen off, you can transition to regular tub baths, and you'll just continue to keep the area clean and dry. Introduction to Newborn Circumcision Care, General Overview. Now, for those of you who have chosen circumcision for your baby, let's go over the care instructions. The initial care depends on the type of device used. We're going to cover the most common types, Gumco or Mogen clamps, and the Plastibell ling. The most important thing to remember is that the goal of care is to keep the area clean and prevent infection. Post-circumcision care for Gumco or Mogen devices. Detailed instructions. With a Gumco or Mogen circumcision, your pediatrician will likely apply petroleum jelly to the area to prevent the gauze dressing from sticking. At home, you'll continue this by applying a generous amount of petroleum jelly to the tip of your baby's penis with each diaper change for about a week. You may notice a yellowish film forming. This is a normal part of the healing process and is not a sign of pus or infection. How to care for a Plastibell circumcision, specific guidelines. The Plastibell method is a little different. A plastic ring is placed under the foreskin, which then falls off on its own, usually within 5 to 8 days, along with the remaining foreskin. You do not need to use petroleum jelly with this method. Instead, just keep the area clean with plain water and pat it dry. When the ring falls off, you might see a small raw area. It's completely normal and will heal quickly. Recognizing potential circumcision complications, important warnings. While complications are rare, it's good to be aware of what to look for. If you notice any persistent bleeding that soaks the gauze, a significant amount of pus or foul-smelling drainage, or if the Plastibell ring hasn't fallen off after a couple of weeks, those are signs that something might be wrong. Also, if your baby hasn't urinated within 12 hours of the procedure, contact your doctor right away. Essential times to contact your pediatrician for any concerns. To summarize the when to worry part, here are the key reasons to contact your pediatrician. Fever in a newborn. Excessive bleeding or discharge from either the umbilical cord or circumcision site. Signs of pain, such as crying when the area is touched. No urination within 12 hours of circumcision. The Plastibell ring not falling off after 2 weeks. Final reassurance and wrapping up your newborn care journey. We know it can feel overwhelming, but you're doing a fantastic job. Remember, your pediatrician is your best resource for any concerns, big or small. We hope this guide empowers you with the knowledge you need to care for your newborn with confidence and peace of mind. If you found this video helpful, please give it a thumbs up. It really helps other new parents find us. Don't forget to subscribe to the Tiny Tots Guide for more fact-checked, expert-backed advice on all things parenting. Hit the notification bell so you never miss a video. And we love hearing from you. What was your biggest question or concern about umbilical cord or circumcision care before watching this? Share your thoughts and questions in the comments below.